peeps, welcome back to my YouTube channel. If you are new to my channel, my name is Chelsea. I am a registered nurse, and basically on this channel all we talk about is nursing, medical stuff, and just lifestyle in general. So if you're interested in this type of a video, or you're interested in how to study in nursing school, or just how to study in general if you are a medical professional, then make sure you guys subscribe to my channel so you can be updated on every single video that I post. So without further ado, let's get right into this video. So if you guys follow me on Instagram, then you probably already know that I have just transitioned from the medical spa life to now doing ER nursing. So ER nursing is so packed with so much information that you have to retain. So I found myself having to basically reflect and review a lot of the things that I learned in nursing school over time. So typically I find myself writing a lot of medications down, as well as doing ACLS protocol and just reviewing a lot of those medications, what they do for the heart, how they affect the body over time, and just remembering certain protocols that we have at the hospital that I work at. So let's be honest, as a nurse you are constantly learning and constantly studying. That never stops regardless of where you decide to go in your career. But what I do to refresh my memory and to study and retain a lot of knowledge, because I have a reading comprehension problem, I always have since I was a kid, I found myself in nursing school really struggling to study. And if you are a person like me and you retain information by audio or visual or like photographic learning, then these study tips are definitely going to be for you. Regardless of if you're a nurse, if you're a doctor, physician's assistant, nurse practitioner, this study tip is going to help you, and this website specifically is going to help you tremendously. So I want to introduce to you guys a website that I used to study that I wish I would have discovered in nursing school, but that is okay because it still is serving me such a huge purpose right now, and it is called Picmonic. So Picmonic, I really appreciate you all for sponsoring this video. This portion of the video is going to be basically explaining what Picmonic is and what it can do for you as a medical professional. Picmonic is a helpful tool that can help, like I said, all medical professionals regardless of your career. It basically is tailored towards people who have reading difficulties or have trouble retaining the knowledge that they just read. So it has different things like photos, acronyms, mnemonics. It also has a playlist that you can create for a specific subject that you want to make sure that you learn. So as I mentioned before, Picmonic uses things like acronyms. So an acronym that I always remembered in nursing school was MONA, or ONUM is what some people know it as. And basically that is something that you do for chest pain. So if you have a patient that comes into the ED with chest pain, then you definitely want to kind of go through the protocols that you remember, but always think of ONUM or MONA. It doesn't matter which way you do it. Obviously you want to do airway first, breathing, circulation, your ABCs that you learned in nursing school. But ONUM is something that I still to this day am remembering and always stick to when it comes to chest pain. So with Picmonic, they use different acronyms and different pictures to help you remember certain things. In addition, when I was in school, I actually had to do HESI exams. Some schools, they actually do ATI as well. I'm not very familiar with ATI, but with HESI exams or ATI, it doesn't matter. Picmonic has both of those available on their website. In addition, if you are a postgraduate, so you're not in school anymore, then you're most likely studying for your NCLEX, or you're actually just studying just to retain certain knowledge if you decided to transition to a different area of the hospital. Picmonic has NCLEX study tips and exams on their website, but they also have things to help you transition throughout your career from different areas of the hospital. So I definitely want you guys to check out Picmonic. So I'm going to go ahead and pull up the Picmonic website and show you guys the interface. The interface is super easy to use for anybody of all ages. If you don't have your computer on you and you just have a phone, Picmonic, you can access it on your phone, but also it does have an app for you to be able to access it as well. Alright y'all, so basically we're going to go ahead and go go over the interface of Picmonic. As you can see, I'm showing you the different subjects that it has to offer, so things like hypertension, pulmonary hypertension, pharmacology, the list goes on and on. So right here, we're going to go ahead and click on the beta blockers because we definitely want to review this.
Remember beta blockers by the beta fish sitting on her throne of blocks. This class of medications ends in the olol suffix, shown by the lolly being fed to the heart. Beta blockers work in 3 ways. First, by decreasing heart rate and contractility, shown by the down arrow heart timer and flexing. Second, by decreasing peripheral vascular resistance, the down arrow peripheral vessel resistance band. And third, by decreasing renin release, the down arrow wrench being released by the heart. Common indications for this medication include hypertension, the Hiker BP, heart failure, the dead heart, and angina pectoris, the angel with pectorals. However, it is important to remember that beta blockers are contraindicated in asthma and heart block patients, shown by the caution tape, asthma inhaler, and heart block. Nursing considerations involve assessing the blood pressure and heart rate prior to administration, depicted by the assessing BP cuff and heart timer. This medication may mask signs of hypoglycemia, shown by the masked Hippo glue bottle, and should not be abruptly stopped, the can't stop cold turkey. So let's review beta blockers. Remembered by the olol suffix, work by decreasing heart rate and contractility, decreasing peripheral vascular resistance, and decreasing renin release. This class of medications may be used in the treatment of hypertension, heart failure, and angina pectoris. However, they are contraindicated in asthma and heart block patients. Nursing considerations include assessing the blood pressure and heart rate prior to administration, being aware that signs of hypoglycemia may be masked, and to not abruptly stop taking this medication.
Okay, so question number 1. Which is the best indication for the use of beta blockers? Your choices are these here. I'll give you guys a second to kind of think about it, but the answer ended up being heart failure. And I'll show you an explanation. It gives you really great rationale as well when it comes to the answer so that you can better understand why you got it wrong or why you got it correct. So for this question here, again, this is the same question we just answered, but I wanted to show you guys that it does show you a hint. So if you click on the hint button, then you can see a heart that is on the right-hand side of the screen. So it gives you a little hint as to what you can remember as far as a picture. And then when you click on heart failure, it tells you an explanation of why that's the correct answer, but it also gives you the dead heart icon. So Picmonic has a number of different subjects that it offers on its website. So things including anatomy, physiology, microbiology, fundamentals of nursing, pharmacology, and so on and so forth. So there are so many different options for people of nursing background, but also people who are of a medical professional background that they can use throughout nursing school or school in general, or just throughout their career as their career path changes. Lastly, I want to show you guys that you can create a playlist for Picmonic. You can put all of your hypertensive medications in one playlist. That way you're able to come back to it whenever you do need to refresh your memory on those specific medications. So if you guys are familiar with my channel, then you most likely know that I did fail my NCLEX the first time. I think personally, one of the reasons why I did fail my NCLEX was because I wasn't retaining the knowledge that I was learning. In addition to that, I wasn't reviewing what I just got wrong. And if I would have had Picmonic during studying for the NCLEX, I definitely think that it would have helped me tremendously in remembering things and using those photos that they use on their website to help me retain the knowledge. Picmonic also uses something called spaced repetition. So what spaced repetition is basically that when you answer a question, it will, if you get it correctly, it will give you a harder question, possibly a select all that apply question, which means that you're doing really well. If you get a select all that apply question after, or if you get a harder question, then more than likely you're doing really well on the exam. So that helps prepare you for NCLEX style questions, and when you do take that NCLEX test, that help challenge your thinking. So typically what I love to do after studying especially is taking out my ER nursing notebook and just reinforcing the knowledge that I just learned through Picmonic. So typically I'll show you guys a picture of what I usually write down. But for right now, I've written down things like stroke, giving TPA, which is called Alteplase, which is basically a clot-busting type of medication. If a patient comes in and they've had a stroke and it is an ischemic stroke, then they could possibly be a candidate for TPA, depending on the time that their symptoms actually started. So just knowing that information and understanding what TPA does will better help me in that type of a circumstance to move a lot faster, because people who are having strokes or people who are having a heart attack, it is definitely a time crunch. So you have to know your information, you have to know your medication, what it is for, what you have to do as far as testing before you can give this medication, so you can anticipate your plan of care for the patient. I also wrote down some things regarding pharmacology. So I wrote down things of beta blockers, what they are for, who they are contraindicated for, people like asthma patients. Beta blockers commonly causes something called a bronchospasm. And basically what that is that your bronchioles are quivering in a sense, or it causes it to be harder for a person who has asthma to breathe. So definitely beta blockers are contraindicated in asthma patients. So I do write that down in my notebook just so that I remember. But I also wrote down ACLS and how certain protocols are for specific rhythms. So because I went to ACLS class today, I'm definitely refreshing my mind on what I just learned in class. And using Picmonic helps me reinforce what I just learned in ACLS class, but also learning about those specific medications and how they work in the body when it comes to certain pulseless VTAC, VFib, or bradycardia. So understanding these things is so beneficial, and continuing to study these things in nursing is the utmost importance in helping with your patient. So if you guys want to try out Picmonic, you definitely have a link that will be in the description box below. I will be giving you guys 20% off of Picmonic, so definitely try it out. It is such a great program to use. It is so easy to use, and you can access it anywhere on the go because it has an app that is associated with it as well. If you guys are interested in that, make sure you definitely check out that link and use that 20% off, because we all love a discount on something that helps us in nursing school, because I personally was a struggling nursing student when it came to finances. So definitely use that 20% off discount code and definitely try it out, because I'm sure it's going to help you guys tremendously. So thank you guys for watching this video. I really hope these study tips helped you in your nursing journey, or if you are a post-grad, I really hope that it's helping you with your NCLEX study routine. If you have any questions at all, or if you have any tips that you could recommend for other nursing students, make sure you guys leave a comment down below, because we are a Nurse Squad family and we definitely are all for helping each other out and just telling each other tips that worked for us or didn't work for us, because your tips that may not have worked for you may work for somebody else. So definitely don't be shy. You never know, it might work for me, honestly. So again, thank you for watching this video. Make sure you guys give this video a thumbs up and subscribe to my channel, and I will see you guys in the next video. Bye guys, have a wonderful day.